I think basically is the ability to not only help people live healthier, better lives and to, treat ailments, but to really try to educate my patients to kind of take charge of their health care. And it's very rewarding when you see someone with good outcomes who's really excited to see you again and be like, hey, this worked, I'm feeling better. My philosophy of care basically is try to use an evidence-based approach, but also knowing that, especially in the field of obstetrics and gynecology, nothing is really all that exact. So it's kind of like you have to kind of feel the situation out, understand what your patient's goals are. Just remember that anything that you're worried about or concerned about when you're coming in, it's probably something that we see all the time, that we're very comfortable talking about, and that you're not the only one that's going through it. It's probably way more common than you think. There's a lot more medical treatments and minimally invasive treatments for things that used to be only surgically managed. So nowadays when we have patients with abnormal bleeding, there's multiple different new types of medications pinpointing the specific cause of it. It's getting to the point where we're managing things less surgically, and if we are doing surgery, we're doing it with a more minimally invasive approach. Approach to treating menopause is all based on the patient's goals, quality of life, and the impact the symptoms are having. So if someone's like, I have hot flushes, but they don't really bother me, typically you don't need to do anything. But the other thing is that if they're not sleeping, they're having issues, then we can talk about the gamut of different treatment options, from hormone replacement therapy to other medicines that kind of help with the symptoms. It's also kind of bridges into like sexual health and kind of counseling older women that it is normal to want to have sex. You should have an active sex life. And if things are not going well, there are things that we can help you with. Thinking of my wife, if she was going to the doctor, knowing that I'd want the absolute best for her, and actually I use that a lot with my patients, being like, if my wife was in your position, this is what I would recommend. And just remembering that our patients trust us, and things that we may think are minor, they might not understand or be more worried about, and really making sure that they feel comfortable and knowing that they're getting the best care they can.